My name is Dr. Jessica Henry, and today I'm going to be talking to you about why you're numb and tingly. I'm just kidding. We're going to be discussing carpal tunnel syndrome, why we have it, how do we get it, how do we get rid of it, all that good stuff. So let's get started. So my name is Dr. Jessica Henry. Again, I'm a certified hand therapist, neurospecialist, and a orthopedic manual therapist. All that to say, I love the hand. So I see carpal tunnel inside of the clinic and in a home health setting often. Within the clinic, oftentimes we have different modalities that we can utilize that can really help improve symptoms. But at home, it gets really difficult managing some of those symptoms. So a really good comprehensive assessment from a certified hand therapist is really good for understanding the start of rehab and like where you need to go to really start seeing those like functional changes and some of that symptom relief that you're looking for. So what is carpal tunnel syndrome? Carpal tunnel syndrome is just inflammation of the median nerve. One thing that people often forget is that it comes from the cervical spine. So it's really important to look at the cervical spine and your posture whenever we're discussing carpal tunnel and whenever we're treating carpal tunnel within the clinic. So I'm here to give you 3 easy tips on how to reduce some of your carpal tunnel symptoms. You're welcome. So we're going to start with first ergonomics, because I know you guys, or some of you guys, thought that new office chair was going to do something. No, we need to go ahead and transition into something that is going to be more comfortable for you as well. But we also need to address the actual desk setup. We need to address the monitor. I'm less inclined to address the chair rather than I am the actual desk setup, and making sure that your head is nice and even with your monitor so you're not overflexed, overextended, and making sure that you are really strong with some of those like postural supporting muscles. So if you do have to sit unsupported, you're not slouching, and that's not putting pressure on that median nerve again. Number 2, wrist braces. You guys could be wearing wrist braces at nighttime and helping reduce some of your symptoms, or at least during some of that aggravating activity. You guys are just not compliant. I see it all the time. I'm just kidding. Some of you guys don't know, and that's the reason why I'm here. I'm giving you guys information so you can kind of take your rehab into your own power, and you can try to make some changes at home instead of seeing some of us within the clinic setting, or having to go see a surgeon a little bit later on when we've waited a little bit too long and now it's starting to wake us up at nighttime. So one of the last things, other than the wrist brace, of course, nighttime and during aggravating activity, is what's one of my absolute favorites? I'll give you guys an easy one: tendon glides. So tendon glides are one of the easiest exercises you can do at home to promote a little bit of circulation within this area, especially after we've been doing a lot of typing activities and a lot of different gripping activities, because the median nerve is sandwiched. It's not breathing. It's kind of like how we have like a garden hose situation. Like if you have a knot in your garden hose, your petunias may not get as much water as they used to. But when we unkink the garden hose by doing some of these stretches, some of these exercises, then some of those petunias can come back to life. But what we always have to remember is that it takes time for those petunias to come back to life. So it's not going to happen overnight just because we did a couple tendon glides. We need to also do a couple median nerve glides. We also need to address some of the symptoms with the brace. And we also need to follow up if it's really getting to the point where we're starting to drop items and you're noticing a little bit of muscle atrophy. All right, so if you guys have any questions, please feel free to email me, or you can reach me at handsonneuroRehab.com. Also, we have a hand therapy carpal tunnel toolkit that has a lot of my favorite tools, including a wrist brace, some of a massage tool as well to go ahead and try to massage this carpal ligament, try to do a little bit of lengthening, and as well as an exercise program that has these tendon glides in addition to other exercises and other things that I absolutely love for carpal tunnel. It is a pre and post carpal tunnel toolkit. So if it is something that you are managing preoperative, it has everything that you need for that. And then if it is something where you've already gotten your release and you're starting to have some of that numbness and tingling, hypersensitivity, or some of what we call that pillar pain within here, there's a lot of scar management stuff in there and some desensitization techniques to help you get back to that prior level of function and your pre-morbid activities, the stuff that you absolutely love to do. This has been Dr. Jessica Henry with Hands on Neuro Rehab's Hand Therapy Tools. If you guys need anything, you know where to find me. Have a wonderful day. Bye.